Dr. Stephanie, I have a cupboard full of inhalers and I don't know what to use them for. This is what we're going to talk about today. Inhalers and what they're used for. And this actually comes from a viewer request. So thank you for asking me to explain this. Okay, so right now I'm just going to talk about our main 3 inhalers. These are what we call MDIs or meter dose inhalers. And these are the ones that spray. So let me just show you this. There you go. These are your basic 3 medications. They might not always come in a form that looks like this. So this is what most people will refer to as a puffer. But then puffers can also be dry powder, so like a Symbicort inhaler. You can have different puffers like this. So there are all different forms, there are different combinations, but for now, let's just start with number 1. Number 1 is what most people call the blue puffer. Its generic name is salbutamol, brand name is Ventolin. We often refer to as a rescue puffer because what it does is it works quickly to open up your airways. So if you are short of breath, if you're having a lot of coughing, if you feel like you can't get a deep breath, what the blue puffer does is it quickly goes in and it opens up those lungs so that you can breathe a bit better. It works pretty fast. You're going to feel a difference within 5-10 minutes, but it wears off pretty fast as well. So like 4 to 6 hours. Most people will have seen a blue puffer before. You would have a blue puffer likely if you have COPD or if you have asthma. Sometimes we also see it just when patients have like a really bad chest infections, like a pneumonia. They will give a puffer so that you don't feel so short of breath. When it comes to side effects of this guy, it definitely can cause some headache, a bit of a fluttery heart. That would be normal, but it should pass off pretty quickly. So these ones would be taken just when needed. Most people would not be taking a blue puffer kind of regularly, like every 4 hours or around the clock. The next most common one would probably be an orange puffer. Sometimes they're red. These would be a steroid puffer. So what happens when you take this is you're actually inhaling steroid right into the lungs with the goal being of reducing the inflammation in the lungs. So if you have asthma, if you have cases of COPD, you can get a lot of inflammation. And so the lungs get really tight. They're just totally inflamed. And so when you try to take a blue puffer, when you're totally inflamed like that, you just can't even get the medicine down. What the orange puffer does is it reduces inflammation in the airways. So now they're not so swollen and now you can breathe better. The thing with the orange puffer is that it must be taken regularly to be effective. It is not a one and done puffer. You have to take it regularly, usually twice a day, morning and evening. You have to have that continual effect in order to really get that medicine in there, get that inflammation to come down. That's probably the biggest mistake that I see with orange puffers, people not using it regularly around the clock, and you really do need to. In terms of side effects with this one, definitely rinse your mouth out after you're finished. The steroid, if it stays in your mouth and throat area, it actually can cause thrush or white mouth. So that's why we say just gargle a bit of water and then spit it out and you'll be fine. So lots of people will be taking a orange puffer every day. Plus, then they'll still have a blue puffer on hand for if they have a flare-up or shortness of breath, or if they're an asthma patient and they find that when they go out for a walk or do some strenuous activity, it still causes shortness of breath. You can still use this one when you need to, even though you took a puff of this one every morning and every evening. Third common puffer. This one, often people will refer to as the white puffer or the green puffer. This medication is called ipratropium, also called Atrovent. It again is another puffer that you do have to take around the clock. It will work better. To be honest, it's kind of like a long blue puffer. The goal of it is to open up your lungs, but keep them open for longer. So it does take a little bit longer to work, but it hangs around for a better amount of time. We're talking maybe 8 hours after you have a puff of this one, your lungs will stay open. So you will see people having these puffers and then taking them regularly around the clock every 8 hours or every 6 hours. And I know that that can get annoying, but really in order for this puffer to work, you really do have to take it around the clock. In terms of side effects, this one can dry you out a bit, so you may get some dry eyes, things like that. So the most important thing to know here is that there are three major types. We have a rescue puffer, which most people will just refer to as the blue puffer. We have a steroid puffer, which brings down inflammation. And then we have an antimuscarinic agent, which is this green puffer, which is really just like a longer acting dilator, a longer acting blue. Now, here's the convenient part. If you're taking all of these puffers, oftentimes we can put it in a combination puffer where you may only have to take 1 or 2 puffs a day, and we actually combine the drugs together. So when you take 1 puff, there could be 2 or 3 medications in there. So if you're overwhelmed by all the puffs that you have to take in the run of a day, why don't you come in and see your pharmacist, and let's see if we make your puffers easier for you. Hopefully this was helpful. If you've got any questions, just pop them below and I'll be more than happy to answer them. Take good care.